My name's David Patterson. I'm 50. 2 years ago I was diagnosed with prostate cancer, and with the help and support of my family and friends and particularly my GP, we've come through this, and prognosis is now very good. What prompted me, there were no symptoms, it was an unrelated issue. And having a sympathetic GP, he basically threw all the tests at me. Normally men wouldn't be tested for prostate-specific antigen until their 60s. It's something that half men will die with it. Your chances when you're 60 of dying of any other cause are much higher. So I went to see my GP and said, hey, how about a bowel cancer test, which is actually quite invasive. When you actually look at the details, you don't really want to have a bowel cancer examination, because as well as doing all of this, he put me in for a PSA blood test. And we had a follow-up probably a year later. We did another PSA test, and it had started to go up, and that itself is a warning sign. He recommended me for a test that isn't actually standard treatment, or it isn't a standard test until 55. Once we started to get fairly high results, and once the diagnosis came in that yes, I had prostate cancer, and once the treatment was underway, he turned around and said, we saved your life. I would not have tested you for another 5 years, and in 5 years this would have finished you. From time to time everyone sees a doctor, and ultimately they're a GP. I started to get the idea that rocking in and seeing somebody completely different every time was not really the most productive way to treat things. And I mentioned this to my wife, who said, oh no, I see the same person every time I go. And she recommended a local doctor, and I went to see him. I'm stressing here that it's up to me to form that relationship, and sometimes it's not easy. Sometimes it is easier just to rock in and see the first person you can. My doctor was fantastic. He just said, I finish at 5:30, anytime you like, phone up the office and book an appointment at 5:30, and that's it. At any time you like, I'll book you in. And that was very important to know. And on a couple of occasions when things weren't looking so good, I took him up on that, and we just have a talk, really. I think thoughts about the family are actually the largest component. I just had a son who was born. He was 12 months old when this was going on, and so working out, well, hey, he's going to have to survive without me. We were not scared, but we were planning in our heads whether my wife would keep the house, whether she'd have enough money to live on, whether my children would continue doing some of the things they used to do with me. You realise that every moment that you have with your family is very important.